From the Toronto Star, I'm Raju Mudler, and this matters.
What kind of a Thanksgiving dinner is this? Where's the turkey, Chuck? Don't you know anything about Thanksgiving dinners? Where's the mashed potatoes? Where's the cranberry sauce? Where's the pumpkin pie?
Happy Thanksgiving weekend. Before we really get to the stuffing of this episode, we revisited that Thanksgiving tradition, a Charlie Brown Thanksgiving. We played that bit for you because in these trying times, whatever you are doing this weekend, please do your best to not be a peppermint patty. COVID-19 has already wreaked havoc on many milestones, family events, and holidays. With Turkey Day upon us, it has become clear that this Thanksgiving is going to have to be different. But looking ahead, can we maybe salvage Halloween? And loath as I am to start talking about it this early, what about Christmas? Colin Furness is an infection control epidemiologist cross-appointed to the Dalla Lana School of Public Health and is an assistant professor in the Faculty of Information at U of T. He's here with us to talk about how best to navigate the holidays. Colin, thank you so much for being with us today.
My pleasure, thank you.
So, I want to talk about the holidays. I think that there's already been a lot of sort of mixed messaging, and I'm not sure if we are supposed to do this or how we're supposed to do it. But Thanksgiving is this weekend. What do you think, and how do you think people should be handling this holiday?
Well, my recommendation is not going to be music to anybody's ears, and it's really predicated in what we really know about COVID, which is it spreads very readily among people who are sharing the same airspace for a prolonged period of time. And that really includes meals, and it includes family get-togethers. COVID is also particularly dangerous when you get multiple generations together, because hardy 20-somethings who don't get that sick can nonetheless make older folks extremely ill. So when you think about Thanksgiving and you think about family getting together, spending the day together, maybe longer, having a great big long dinner together, this is dangerous from the perspective of COVID. And so my recommendation, although I take no joy in saying it, is that families really need to stay to themselves this Thanksgiving weekend, just in the interest of keeping family members safe. So my recommendation is very strongly, for families just to stay home, stay by themselves, use Zoom, use the phone, feel sad about what we're missing, but feel safe.
I think holidays is one of those things where they've been a flashpoint through this already. I think the one that I remember at the beginning of this was Mother's Day. And I believe there was a spike after that. One, did you see that? And two, it feels like we've already lost so much, but there's a point in trying to stop doing it. And that's basically to try and get control of this, right?
There was a bump after Mother's Day. It wasn't a gigantic bump. Of course, back then, the weather was getting steadily warmer, which means the weather was actually helping us. What we have now, obviously, is the reverse. So I'm expecting there to be a bump. Unfortunately, I'm expecting it to be bigger. And part of it is around ambiguity around rules. And in Mother's Day, I remember very clearly, right after Mother's Day, the Premier standing up in front of reporters and boasting about how he'd had his extended family over, which was in violation of all the rules. Now, he wasn't sneaking around. He wasn't pretending he was better than other people. He genuinely, literally didn't understand what the rules were, even though he was the one responsible for telling us all. And he was baffled by this. He felt broadsided by people saying, well, wait a second, you've actually violated your own rules. He didn't know that. So if he didn't know that, and he's the one who's actually supposed to be telling 15 million people how to stay safe, we've all got a problem. I think the rules have gotten more complicated. I think the messaging has gotten more muddied. And so I think given all of that and the weather, we're in much worse shape for Thanksgiving than we were for Mother's Day.
Completely agree. And it's one of these things where I think that the messaging right now, at least it seems to me that we've heard lots of things. We've heard the Prime Minister say, let's try and skip Thanksgiving so that we might save Christmas. Is that a real thing? I mean, I look at the Melbourne lockdown and it was 3 months there. Basically, if we really shut things down, could we possibly have Christmas? Or should we already be preparing ourselves that that's probably off the table?
Well, a lockdown done properly only actually needs to be a few weeks long. But if you think about what we did in the spring, it was more like a couple of months. It was not well done. We left pie shops and all sorts of stores open when we shouldn't have. We weren't disciplined. We didn't do any kind of enforcement. We did very little messaging. And although most people complied, really remarkably, there wasn't full compliance, and therefore it just dragged on for a really long time. I would never say, let's skip Thanksgiving to save Christmas. I don't think that's how this is going to unfold at all. I think Christmas is going to be even more dangerous than Thanksgiving. I think we have 8 really difficult months ahead. And it's not about saving Christmas, it's about saving lives. And I think that's a far, far bigger worry.
Well, this is one of these things. I think that there's a dissonance out there in the public. I think that this is one of these things where we had a fun August. We're seeing some scary numbers. I think a lot of people are like, the word is calculated risk. People are thinking, well, I haven't seen my family. I want to do Thanksgiving. I think we're probably going to lockdown, so we should do it this weekend. What do you have to say to that?
I think the more that people get together for Thanksgiving, the more likely a big lockdown is. I don't think that's inevitable at this point. I think we're masters of our own fate. But if everyone has one person over for Thanksgiving dinner, we're going to have hundreds of thousands of contacts, hundreds of thousands. And that's going to result in literally thousands of cases. And that is really concerning. That might push us into something severe like a lockdown. We shouldn't have to. We should be able to do targeted interventions because we really understand COVID very well now. We didn't in the spring. We do now. So we could be doing this a lot more differently and a lot more carefully, but we haven't so far. Thanksgiving is poised to add a really big log on an otherwise really scary looking fire. And yeah, we may precipitate that. So ironically, rather than thinking there's a lockdown coming, I better get in my last gasp, we may force a lockdown in consequence of our behavior.
So it's funny, we did a story where campaign research poll where a lot of people said that they're going to try to have a small Thanksgiving and then skip Halloween to try and get this under control. Now, this to me illustrates exactly who you are polling, because I have an 8-year-old and I mentioned that small Thanksgiving and skip Halloween, and the answer was no. So she knows which holiday she would like to have. What about Halloween? We're already talking about it. Hey, we all wear masks for this holiday. It is outside. Is there any way that we might be able to have Halloween?
Well, of all the things where I might want to give you a glimmer of hope or good news, I think Halloween's it. And it's for the reasons you suggested. Not only is it the one day where wearing a mask makes sense, but it is predominantly outside. And certainly in my experience in my neighborhood in Toronto, parents go with their kids. So it's actually very supervised. And the one thing to really worry about is kids clumping together. They're very excited. They go in giant packs and they descend upon a house in a huge frenzy. So we need to space that out. There's no question we need to space that out. We need to think very carefully about people who feel unsafe to turn their lights out and not participate. But I think we can do a modified trick or treat. I think we need to be careful and mindful about how candy is dispensed in a way that just maximizes distance and takes advantage of the fact that there's a wind blowing. Remember, it's indoors where COVID poses a gigantic risk. I almost every year nonchalantly say to my kids, I think Halloween's canceled this year, because it's sort of the meanest practical joke thing I think a dad can say. And this is the one year where I'm really saying this actually isn't funny. We need resilience. We need mental health. We need to take care of our kids and recognize everything that has dented their childhood over the last 6 months. I think we need to keep Halloween. It's outdoors. We need to be careful. We need to be mindful. But of all the things that we might want to sacrifice, I don't think this should be on the list.
Well, I know that I have an 8-year-old constituent who will be very, very happy to hear your professional opinion on that. So I appreciate that. Let's take this a little further. In terms of how can I give out candy? Is there a safe way? Is it, leaving it on the front porch so they can grab it by themselves? What do you think?
I think being able to extend candy on a tray or other sort of thing like that, so you can just maintain a bit of distance as you're handing it, ought to be just fine. Again, you're outdoors. This should be okay. One of my children's classes, or they're working in their science class on ways that they might do this. And my secret weapon is actually going to be a big wide sewer pipe, like a 4-inch wide plastic pipe where we can just have a slide. Put your bag into the pipe and slide it down. That's for theater. I honestly think if we can just keep a couple meters between people, if we can have everybody wearing a mask and the exchange is going not inside, not in the doorway, but outside on the front step, I think we'll probably be okay. As long as, again, people who are particularly vulnerable, people who have underlying health conditions, people who are anxious about this, this is the year I think maybe to turn out the lights. But for people who don't have significant risk factors, who are prepared to be outside, and that can be kind of cold, and have a tray or some other kind of thing to just be able to hand candy at a bit of a distance, I think that would be just fine.
We'll be right back. We've learned a lot about how COVID-19 has spread. I think there's been a number of really, really interesting studies. There was a giant one in India about super spreaders and young people there. One of the reasons I'm bringing this idea up, I'm wondering, one, if you think young people have been perhaps demonized, or blame is too strong, but in terms of the spread right now here. But the other thing is about Halloween, and that for people in their 20s, Halloween is probably one of the biggest party weekends of the year with costume parties and such. So there's a danger in that. And obviously, I'm pretty sure you're going to say don't have parties. But I also am curious about young people right now and sort of where they are in spreading this disease.
So let's deal with Halloween first. No question, an indoor Halloween party is exactly what we don't want. No question, we don't want that. No one should be gathering in parties at all indoors. We just shouldn't be doing it. This is the wrong time, the wrong year to do that. If we think more broadly about the 20-something demographic, yeah, I do think they are being treated rather unfairly. This is a group that I teach, so I talk to a lot of 20-somethings. And the ones that I talk to are very cautious. I sometimes go for walks with my students, and I pay attention to people's behavior. My students are really cautious. Now, it's also true that wherever I go these days, I feel a bit like the priest at a stag party. I think people are kind of mindful, what does Colin think? But when talking with them about their routines and their habits, now I think there's a majority of 20-somethings who are acutely aware of the dangers, that really understand, have been very thoughtful and understand what their role is in spreading or not spreading. But there is a subset of 20-somethings. And if I think back to when I was in my 20s, I'm not sure how well behaved I'd be. I felt invincible in that time in my life. I felt pretty self-entitled. My social life was really important. My dating life was really important. And so if I were in my 20s right now, I'm not sure that I would be holding myself to the standard that I would kind of expect now that I'm an old guy and can see it a bit differently. So I do want to be sympathetic and I want to be compassionate about the challenges this group is facing. I've been suggesting for a few months that just do it outside. Get together outside. Outside is the rule because there's just going to be less spreading. You don't get super spreader events outside. Outside is not perfectly safe, but the risk is much lower than in a crowded, indoor, confined space with poor ventilation. So I think the 20-something group is being kind of unfairly labeled, but at the same time, that's where the spread is happening. There's no question. I mean, we've got pretty clear data about that. And I think part of the problem here is actually the way we've enacted our rules. So we have said you can go to a restaurant or a bar, nominally 6 people to a table, but you can go there with 24 of your best friends. No one's sitting down. Everyone's having a good raucous time. There's hugging, there's kissing, there's singing, there's shouting over the music. And we are saying in our less than infinite wisdom that this is okay, that this is somehow acceptable. And it's not. But then we're saying you can't do that in your living room. And I don't think people are buying that. I think they're thinking, I can do this. I can do this in a restaurant. Therefore, I can do this in my living room as well. So we're creating a situation by allowing bars and restaurants, I'm talking about inside dining, not outdoors, where we're creating the stage for spread and we're telegraphing that this is somehow okay. And it really isn't. The people who are most at risk, by the way, in a restaurant setting are not the patrons. It's the wait staff because they're wearing masks to protect the patrons. Patrons are not returning the favor. And whereas patrons may be there for an hour or an hour and a half, and maybe they're with people they're with all the time, so that's slightly lower risk for them, the wait staff are there in that enclosed space for hours, and they're dealing with hundreds of people. So their occupational exposure is enormous. In fact, I would say after healthcare workers and other frontline workers, the most COVID dangerous occupation in Ontario right now is that of server or bartender. We're not proactively testing them. We're not looking at that group carefully. We're just sitting back and assuming everything will be fine. Well, they're getting sick, and they're getting sick in a way that doesn't debilitate them. And this doesn't apply to every server, but there is a party culture among servers. You work your night shift, and then you party the rest of the night with your buddies. And then, of course, you go and have a good time with your other 20-something buddies who don't work in service. So we've got an ecology here where restaurants and bars are creating a situation where everyone feels like there's no rules. And wait staff in particular are vulnerable, and they're, I think, spreading it among their buddies. Is this their fault? It doesn't really feel like it's their fault in that scenario. It's a serious policy problem. It's a gigantic blind spot. I have to say that our willingness to let people congregate in bars and restaurants in Ontario right now is flat out negligence. I can't use a different word. I can't use a later word. It's negligent. I place it right at the feet of our Chief Medical Officer of Health. And I need to call this out. This is negligent. This is not okay.
I think this is one of these things where it feels like there's a conflict happening here between the Toronto Public Health that wants to shut everything down and the Premier who, yesterday just said he wants more data about this. I think this is one of the things we've been talking about, the mixed messaging and how confused it is, because you're allowed to have a good time over there, but you're not supposed to have a good time over here. How do we solve this? Is it shutting things down now? Is it the targeted intervention of shutting down indoor dining? Which it sounds to me like people think it's overdue.
It's long overdue. And it's kind of appalling to hear the premier, who doesn't understand public health, doesn't understand pandemics, say that he needs more data. He wouldn't understand the data if he had it. But let's also remember that what he's referring to blithely as data is people getting sick and dying. I think we've had enough. I think we have plenty of data. What we need is a new chief medical officer of health who's prepared to act, who's not going to simply preside over this pandemic and commentate on it, which is really what we've had for 6 months. So I think we don't need more data. We actually need action. And based on everything I said around restaurants and bars, the logic is simple. I mean, my kids can understand this logic. This is not esoteric. This is not complicated. And it's based on a really sound understanding of our knowledge of how COVID spreads. It's not spreading by touch, at bus stops. It's spreading in enclosed spaces. It's spreading in exactly the kinds of situations that we find in restaurants and bars. And more data is going to show us that, yes. It's going to demonstrate that, yes. But why don't we avoid more data instead of anticipating?
I'm just curious, do you have any other things? I mean, you're pointing out servers are a danger. You talked about some of the young people party culture. What are the other things you're seeing out there right now that are surprising you or disappointing you about how we are reacting to this?
Well, I guess I'll point to two things. I'll say on the provincial level, we have never had anything like an appropriate testing strategy. We're dealing with a crisis now in capacity, which was easily foreseeable. But the bigger problem is, as we grew our capacity, Mr. Ford simply threw the doors open to the testing centers and said, anyone come on down, this is fun. So people who have agency can do that, and people who are in vulnerable, marginalized populations don't. So we use up our capacity, but not in an intelligent way. We shouldn't be inviting people to assessment centers based on their agency and ability to do so. What we should be doing is anticipating risk and then going to workplaces, going to migrant farms, going to long-term care homes, going to schools and testing teachers, testing waiters and bartenders. We should be doing that in a mobile way and going where the risk is. To test just where symptoms are, and again, this is the preference of our Chief Medical Officer of Health, who's got testing strategy completely wrong. Simply waiting for people to be really sick to test to confirm is not what we need. Half of all COVID transmission, at least, is asymptomatic. That means to say that the people who are spreading it around feel fine. That's where we need to interrupt things. So we need to go where the risk is and test there. We haven't done it. Ontario has still not acknowledged that this is an asymptomatic pandemic. They're just not going to acknowledge it. And that's a problem, because if you don't actually understand the problem for what it is, then you're not going to craft a testing strategy. The fact is our capacity is not even remotely what it needs to be. I was suggesting back in June and July that we need to prepare for a capacity of about 200,000 tests a day in Ontario. So we're doing 40 or 50. So we're maybe at 25% of what we need. And that's based on knowing that we were going to send nearly 200,000 teachers back into classrooms, that we were opening restaurants and bars and the hundreds of thousands of people who work there. Every store clerk who's got occupational exposure. This is where we need to do testing. We're still not doing it. And the fact that we're now rolling back testing, limiting testing because of our criteria, this is not good. This is not heroic. This is not evolution. This is essentially inheriting the consequences of a really incompetent testing strategy that's been going on for months. And that is so dismaying, because that was so easy to foresee and so easy to plan around. There's we can get into the technicalities of it, but there's ways to grow your testing capacity that we could have done, should have done, and simply didn't bother to do. And that, to me, is absolutely tragic. So testing is one thing. On a federal level, I'm really concerned about what we're letting our airlines do. We're letting airlines fill their planes if they can. We are letting them advertise seat sales to pack people in planes to send them to COVID-ridden capitals around the world and bring them back again. We don't have a lot of data on transmission in airplanes. And one reason for that is because in Canada, anyway, airlines are not required to produce manifests. An airline can get you a boarding pass and get you seated. They can't produce a list of who sat where on domestic flights. International flights, they can. Domestic, they can't. So we have a lack of data. Moreover, because transmission's asymptomatic, it's very hard. If someone never reports to test, they could spread all over the place and will never make the epidemiological link. So we kind of have to look at airplanes as a risky situation. They recirculate their air. So we've got airlines behaving in ways they simply assert that planes are safe. Well, they're not. Now, I don't want airlines flying at a loss. I realize that's not reasonable. Flying simply has to become more expensive. You have to increase ticket prices to make up for that middle seat. Imagine the entire airplane was business class, where people actually had a bit of space to spread out. And yeah, tickets would get a lot more expensive and planes would be a lot less full, but they could still make money that way. Fewer people should travel until COVID is done, and travel should cost more because it's going to be more expensive to do it in a way that's safe. The business model of pack as many people in as you can for tickets that are as cheap as possible just is not a good idea. In fact, it's much worse than not a good idea. It's harmful to Canadians, and I don't think we should tolerate that.
Well, I'm glad you brought it up because to bring this back to Thanksgiving, this is obviously one of the weekends where people will be traveling. So hopefully there will be some of a kibosh on that. I do want to ask you, sir, as a last question, what are your Thanksgiving plans?
We normally have 3 different family dinners. So we normally have a very busy Thanksgiving. We're doing none of those. We'll have a quiet Thanksgiving dinner at home. We think we will, if weather permits, go for an outside walk with one of the extended family branches that we normally have dinner with. And we think we're going to give them a pie. We think we can do that safely. That's our story. I mean, homemade pie is a big piece of our Thanksgiving, so we're going to spread that around rather than COVID and really just keep to ourselves.
I think my plan is to do some porch drop-offs with my family, short visits in the backyard, and sounds about the same. I think pie is also on the menu from here. So I want to really, really thank you for your time today. This has been really enlightening, and I really appreciate your time.
My pleasure. Thanks for the chat.
Colin Furness is an infection control epidemiologist cross-appointed to the Dalla School of Public Health and is an assistant professor in the Faculty of Information at the University of Toronto. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Raji Mudder, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.